Now I have the honor to pass on to your neighbor, Dr. Chan, to the United Nations Secretary General Special Envoy on Ebola, Dr. David Nabarro.
Thank you very much indeed, Your Excellency. I hope that the line will stay open while I am addressing the members of ECOSOC, and I would like to pay tribute to you and to your membership, to the President of the General Assembly, to the Secretary General, to the ambassadors from the affected countries, and all others present for putting this issue right squarely at the centre of the attention of the Economic and Social Council. I've just returned from a period working with the people and governments of Guinea, Liberia, Sierra Leone and Mali. I also visited Accra. I had more than 50 meetings, went to multiple locations and attended a number of very specific events which enabled me to understand the way in which the response has evolved. I really was impressed by the national responses, what's being done by the people and the governments, their vigour, their intensity, the way they are adapting their institutions, their tireless energy. In some cases, they have not had a day off since March. They are working with very little sleep. They are all committed. When I say to them, how do you feel? Why don't you take time off? They say, we can't. We have to stay with this till the very end. We are committed because it is for our people and for their future. I'm impressed by the African response, the international response, by the synergy, the openness, the willingness to reflect and learn, as we heard just now in the presentations from the participants from the region. Really, I am also very clear in my mind about how people and their ownership of the issue is transforming the shape and face of the outbreak. I admire the courage and dedication of everybody who's working on the response, and I really mean this. There are people who are working 24 hours a day, involved in the care, in shifts, in direct contact with people with Ebola, taking considerable risks, doctors and nurses, people in civil society, Red Cross volunteers, international workers, the African Union Force, ECOSOC, staff from the United Nations, sometimes peacekeepers, and obviously all other responders. And I really do think that we are so dependent on these people for bringing this really awful outbreak to an end, and they deserve our continued appreciation. Since my work started on August the 11th, I have seen real shifts in the way in which governments are handling the outbreak, the setting up of emergency operations centres and incident management centres at national level, but also in the cities like Monrovia and at district level, at county level and prefecture level. I've seen how societies have come to own the response, starting to adapt really important traditions so as to reduce the risks, particularly those associated with death and burying or those associated with illness and healing. I've seen how the outbreak is being analysed now, broken down with the help of our friends in WHO into at least 100 different micro outbreaks, each with their own chains of transmission, intensity and stages of evolution right across the region. Our findings are that when all the ingredients of the response are present to stop the transmission, treat people with illness, provide essential services, preserve stability, and prevent spread to other areas, and when the countries are able to take full charge of the response, when the communities are able to change their behaviours, when treatment is of high quality, then when the partners also are fully coordinated, transmission slows dramatically. In Liberia, in September, there were 60 new cases per day. Now, for the last 2 or 3 weeks in Liberia, the case number has dropped to 10 new cases per day. A success, yes, but still, unfortunately, that is the level that it was at the beginning of August. We still have some way to go. In Liberia and Guinea, 70% of those with the disease are undergoing treatment in institutions of various kinds, and most of the burials are safe. In Sierra Leone, we've seen how the areas to the east are now mercifully experiencing much lower levels of disease. High transmission, however, is flaming up in the west, and an urgent response by the government is underway. And in Guinea, in the large area Forestier, and also in Foricare, there are still dispersed areas where people are experiencing quite high levels of disease. As the response evolves, so the effort to reduce transmission by providing lots of treatment facilities and making burials safer is complemented by the painstaking effort to find cases, trace contacts, reduce the numbers of chains of transmission, and to get to zero, our elusive goal. Without getting to zero, the disease can reignite at any time. To get to zero, we now realize we need increasingly good data that is granular, that helps us to all know where the outbreak is going. And we will put in place nimble, flexible, and adaptable responses with the United Nations and other entities ensuring that governments are supported by skilled people with epidemiological and contact tracing capacity in at least 47 local government areas, with communities that are helped to be alert and vigilant to identify any new cases and chains of transmission. This means, as we've heard already, emphasizing the importance of trust between communities and authorities so that they become the center of the response. In the longer term, we know that this outbreak has damaged the fabric of society. It has undermined the quality and impact of government services. It's already having a very bad effect on economies and is threatening stability in some places, as we've heard within the Peacebuilding Commission. Nutrition levels, particularly in affected communities, are low. Health services are damaged, as Dr. Chan said. Poverty is on the increase, and people are stigmatized, particularly women and even children. But I heard the presidents of all the affected countries, including the president of Mali, tell me of their determination, not just to overcome this outbreak, to lead and to ensure support of the rest of the world, but to make certain that their countries not only recover, but use this outbreak and the misery associated with it to get stronger and to revive and become more resilient. They ask for greater transparency on the use of resources, for clarity on results achieved and lessons learned. They ask us to coordinate better, and most importantly, they ask us to get our messages greatly improved so that recovery can be speedy and effective. I believe, Mr. President, members of ECOSOC, that it's our duty within the United Nations system and the international community to enable the presidents and people of the countries with whom we are working to be helped on this way to get rid of the outbreak, but most importantly, to recover fully and effectively for a better future for their people. Thank you, sir.
I thank Dr. Nabarro for his statement and also for his personal dedication in the fight against Ebola. Again, my thanks go to Dr. Chan for having also participated